Okay, the first question is, what are the most important health challenges facing Nigeria?
I'm sure listening to a lot of the previous panelists, we are very aware of the health challenges that face Nigeria. To put it under two broad perspectives, when you look at every healthcare system, you have the demand side and you have the supply side. And you have a lot of components under this that plague the country presently. In terms of the demand side, we're looking at access to healthcare, the affordability of healthcare. Right now, you have about 98% of people paying out of pockets. You have poor coverage by the NHIS. So there's a huge gap in terms of the ability to access healthcare. If we also look at the supply side angle of it, you look at the quality of healthcare that is available around, and there's also a dearth in that. You have human resource challenges. I mean, it's a whole gamut of things that affect the health challenges in Nigeria. However, I think that rather than focus on the challenges that we have, one of the things that we need to look at is how to solve those challenges, and we'll be able to do that under the two broad headings. I'm sure that we will discuss that on the topics. Thank you.
Thank you. I will say infrastructural development, because it's not as if there are no hospitals, but what the challenges we have with the existing hospitals is that the majority, if not all, are dilapidated and no upgrades. And of course, when you talk about infrastructural development, you also talk about human resources, which has been mentioned in the course of today. Those will be two major areas I think we need to look at. And I think a lot has been mentioned on the primary healthcare in terms of the kind of opportunities that does exist, because those are the facilities that are closest to the people at the bottom of the pyramid. So if things are done around them, I think there can be a great improvement in healthcare delivery in Nigeria.
When we talk about what are the most important opportunities in healthcare financing in Nigeria, first of all, before we talk about Nigeria and healthcare financing, there are some certain indices that we need to look at and think about. First of all, in a country where, in a continent that you have about a concept of 11% of the total world population, but carries 24% of the disease burden. We're in a country also where 60% of healthcare is provided by the private sector, and also about that same amount of percentage is funded by the private sector. And so one of the things we need to consider is when you talk about the opportunities just do not lie within the private sector, but also not within the public sector, but also extends to the private sector. And one of the things I want to talk about this under is when you look at the way you mobilize resources for a healthcare financing system. First of all, I will discuss this under each heading. The first thing is you want to first of all look at how you can increase government revenues. And one of the things that you'll be able to do by doing that is one, increasing efficiencies in taxation, also improving government expenditure, and also social health insurance schemes. And one of the opportunities that lie within that right now is what is happening with the NHIS and the social health insurance schemes at the state level, the state supported health insurance schemes. Right now, as we know, over the years, the government has been able to subsidize free healthcare with oil money, but we are now in a situation where there is no more of that happening. So we are now stuck with a situation where people need to begin to pay for their healthcare systems. One of the things that NHIS has done is to sort of deregulate itself and give the states the capacity to set up their own health insurance schemes. Now, what has this done? One, it has given the opportunity for healthcare to become mandatory. Two, it has also given the opportunity for the purchasers, for the purchasing of healthcare to be at the level of the government, but the provision of healthcare to be at the level of either the private or public providers. And what does that do? That creates competition. And what does competition do? Competition breeds quality. But what am I trying to say here? One of the things that we should consider here are two things. One, health insurance now is going to become mandatory, hopefully, across the country. It's not the best system where each state has its own state-supported health insurance scheme, but it's what we can do right now. Lagos State has passed the law, Ogun State is in the process of passing the law, Delta State has passed the law. I mean, all the states are coming on board and making healthcare mandatory. What this does is that it provides a constant revenue of funds.
Mr. Azad Ayas, Ayaz. Now, you are in the private sector. You're not in government. So, I'm going to push the question to you about government, because I want an independent opinion from somebody who's outside as to how better we can manage what we're doing right now as far as healthcare finance, the little that we have there. Now, how do you think, or how would you suggest, what are the recommendations that you would make that governments can better use their budgets, small budgets to improve the provision of healthcare?
The question is, you said small budget. It's not really a small budget. The expenditure that is being done by the government on the health system is quite large, but it's misdirected, in my opinion. How they could improve their expenditure is by directing it better, instead of going into spending into the public sector. I think everybody has said the same thing today, that the private sector should be the one that has to be invested in, even by governments, and to be supported. The amount of money that is being spent in the public sector is not making enough ground or enough improvement to pay back that investment. It's not really an investment, it's a donation. I mean, basically the government is just donating into the public sector without having any revenue or return on interest, because in health, return on interest or return on investment actually is seeing a result in the patient outcome and the quality delivery of healthcare. And that investment is tanking, in my opinion. So I think that what my colleague said about competition breeds quality, the private sector only has to be competitive to improve its quality. However, if the government is competing with the private sector, then the quality of the private sector is only going to go down compared to what is being envisioned for the future. So basically my advice would be to build on capacity building, to invest in capacity building, train the doctors, give them good education and good quality management provisions so that they can go out and work in the private sector. They can be posted by the government into the private sector. It will be a part of a kind of a PPP, however, not by just providing a place to work. It will be by providing the facility of infrastructure and by providing the capacity, the skill to give that service out. So basically investing in capacity building and bridging the gap between the private and the public sector.
And the next question goes to Mr. Kulaja, and it's about the National Health Act. Do you think that the National Health Act of 1% of consolidated government revenue will be implemented? If no, why? Why not? And if yes, why?
Whether or not I think it will be implemented or not, I don't really think it is the issue. The question is, or the answer actually is, it should be implemented. Whether or not it's a law, the federal government has committed to it and it should be implemented. And why should it be implemented? I mean, we've discussed a lot of the issues here already. The funding for the healthcare in Nigeria is really poor. It is about 3.7% in terms of what the government is allocating from its revenues. Also, there is poor inflow of investment into the country. But what brings more concern for me is when it is implemented, will states be able to access the fund? That's what is most important. And why? If you look at the National Health Act, we know that 50% is going to go through NHIS, you know that 45% is going to go through MPHCDA, and then 5% is going for Ministry of Health. However, there's a caveat there, that for every project that is going to happen, each state must put 25% of the investment before they can access that. The question for me now is, are states able to put down that money? Do states have funds? So whether or not it's implemented is not the problem. The problem is that if it's implemented, will states be able to will states be able to access the funds to do what it's supposed to do? Is it just going to be another SOML that has sat down in the coffers for a bit of time, or what is exactly going to happen? But I see an opportunity for the private sector here. So this is where the private sector needs to stand up and partner with states to see how they can access the funds when it is finally implemented. But should it be implemented? Yes, and I think the basic reason is because there is a need for more funding for the healthcare system. There might be an argument that recently the SML funds $500 million IDA to the health systems, enough for the health sector. However, we're a population of 200 million people with about 80% of us living below the poverty line, accessing poor quality healthcare. I don't think I need to emphasize it more than that. Thank you.
The next question is a general question to every one of you. So we just want your opinion on this. Brief opinion, but very succinct. What do you think the government can do to increase its spending for health?
Okay, let's take a step back a little bit here. The question is, what can the government do to increase spending? Do they want to increase spending? I don't think that they want to increase spending. I think they want to cut it down. And that's what we're trying to see here. How can we reduce the expenditure from the government and bring it in from other sources, from the private sector, and to build on that. But basically, to increase the expenditure, they need to see a result. It's a result-based investment. So if they see that there is a result from the health sector expenditure, they can now start diverting more money because it becomes a money generating or revenue generation resource. Because if you have a healthier population, then you have a healthier economy. You have less burden on your economy to be able to generate funds. Then you can say to a healthy person, I'm going to tax you a little bit more. They're not going to be groaning under the pressure. They're going to be saying, fine, I feel good. My family's taken care of, I'm working. If I'm taxed a little bit more, and that's how it is in Europe, in the States, and everywhere. Once they're healthy and they're working and they're able to provide the full spectrum of their abilities, then you can tax them a little bit more. However, I just want to go back a little bit to one of the things that are facing the health sector. Data. We don't have data. We don't know really what is happening in the Nigerian health sector. We don't have enough data to be able to make an educated, even sometimes an educated guess as to how we can invest in the private sector. Dr. Nana, I think if he's still around here, said something this afternoon or morning about if you're planting yams and you leave them. But if you have a garden and you need to know what is in your garden so that you can help it better, you need to know how many yams you have, how many weeds you have, and what sort of nutrients they need. But we don't have this data in Nigeria. We don't have access to transparent data. To get that, I think PharmAccess was based on the research of Professor Lang in triple combination therapy for the treatment of, or the palliative of HIV. And also the Nigerian health sector requires a triple combination therapy. And that is, it needs the three sectors between the financial, the technological, and the government to work together to acquire the data, to get enough data into a kind of a database that can be accessed by investors from inside and outside, to be able to mine that data and know where to invest properly. And that will give us more, even the banks then would be more interested, as the gentleman from AXA, Mansard, said, that he was funded to get that data because people want it. I was running a study last year, macro analysis on the health system in Nigeria. I've been in Nigeria for 17 years, and I consider myself more Nigerian than anybody else because I've lived here more than I've lived in any other country, even my home country. So I thought I knew the health sector. I thought I could, oh yeah, easy, I can answer this. And when I looked at the questions that were there, they were primarily directed about primary healthcare, imaging, and pathology in the private sector. They really wanted to know how the private sector fared against the public sector. I can tell you, I spent about 2 months looking for data, and all I could get was some paltry, information. I begged to ask my colleague where he got all those numbers from because I couldn't find them anywhere. 98%, 70%, 60%, and he was very sure about that.
While it might be a bit difficult to answer the question on behalf of governments, I think there are quite a number of other things that governments it may be easier for government to do than just increase funding. I think there could be a lot of policies that could be formulated to make it easier for the health sector in Nigeria to thrive. And even at the, I think, not too sure in terms of statistics now, so that it doesn't take me home like it's done to Lumine. But I think that if students in even secondary school are being encouraged to take the science courses that lead you to being able to study medicine and related courses in the university, it can also start to bridge the gap in terms of human resources. The other one is also conducive environment. PHCN has been an issue in Nigeria for a long time. If there is light, I'm sure services will get cheaper. When we were at lunch, somebody was saying that just between yesterday and now, that the prices of tomatoes have dropped, and I'm saying how significantly could that have happened overnight? And does the effect of the foreign exchange, does it have a direct impact on the cost of tomato? If you could have that much direct impact on the cost of tomatoes, I'm just so sure and certain that if basic infrastructures are in place, it makes it, the environment more conducive for people to try. I mean, for those that are in more specialized sectors like the fertility hospitals, they rely heavily on power. If power is not in place, they can almost not do anything. So I think there are a few other things that if government put in place, it will improve healthcare directly and significantly, and also perhaps the potential to reduce the cost at which the services are rendered to people. I just thought that was also very important.
I just want to add something. What can the government do to increase its spending? I mean, I can tell you a textbook answer to that. When you talk about resource utilization for health, I can tell you they can improve taxation, they can improve healthcare efficiency, they can do this, they can do that. But I think the question actually is, what can we do to make government increase its spending on healthcare? Because for governments to do it, it's a decision. They can just decide. But for them to make that decision, then they have to have evidence and they have to have a reason to do that. So one of the questions that has plagued me a lot in a society where we are led by politicians, and politicians who want to be able to show the reason why they need to become elected at the next season, is how can we begin to make healthcare tangible? How can we begin to make healthcare something that government can see, account for, and also be able to tell people that I did this for you? So one of the things is the focus on outputs. How can we as donor organizations, how can we as people, how can we as the private sector provide enough evidence to show to government and say, look, government, based on these interventions, these were the outputs that were